As more female physicians enter the workforce, they face persistent challenges that can lead to burnout, including pay inequities, discrimination, and an imbalance between responsibilities at work and home. To tackle those issues, 6 leading healthcare associations, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Hospital Association, and the American Psychiatric Association, funded by a grant from the Physicians Foundation, have formed a partnership that brings together early to mid-career female physicians for networking, mentorship, and leadership training. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer in AHA's Washington office, and your podcast host. In this podcast, our Vice President of the AHA's Physician Alliance, Elisa Arispacochaga, talks with women's physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program.
Welcome to another in AHA's ongoing series of podcasts where we focus on important issues facing clinical leaders. I'm Elisa Arispacochaga, Vice President of AHA's Physician Alliance, and today we're talking with physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program. The AHA's Physician Alliance joined a consortium of 6 organizations, including the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Physicians, the College of Obstetrics and Gynecology, and the American Psychological Association to develop a program to address wellness and leadership needs for women physician leaders over the next 18 months. Joining me is Dr. Dawn Sears from Baylor Scott White Health in Temple, Texas, who was nominated by the AHA to participate in this program. So welcome and thanks for talking with me.
Thank you so much for having me, Elisa.
So to get us started, tell me a little bit about yourself and where you are in your organization.
Sure. I'm a full-time practicing gastroenterologist. I'm actually the section chief for gastroenterology. I'm also the mother of 3, and I'm married to an amazing, supportive husband who allows me to do things in my organization and on the national level in leadership. I've been surrounded by so many supportive mentors and those other leaders here at Baylor Scott White that have allowed me to work in the women in medicine space. So I'm getting to do many diverse things that I never would have expected 10 years ago.
So tell me a little bit about how you got into medicine. What drew you to it, and then subsequently to not just treat patients, but also pursue that leadership role?
I was actually the first person in my family to graduate from a 4-year college. I come from a farming family, so education was valued, but not necessarily the go-to strategy. So I knew that I wanted a stable field where I could work with people from all walks of life, that I could work with the farmers and the CEOs and the homeless, et cetera. So I somehow ended up in medicine, and as I progressed in my career, it became obvious that burnout and the imbalance of life work and unrealistic expectations for myself and my colleagues was going to be a real threat to the longevity of all the dedication I'd put in and all the training and time and energy and sacrifice. So I started working towards serving my colleagues, and I knew that if I could help 2 or 3 or even 4 doctors stay in practice a little bit longer, then my impact to patients would be amplified much more than just the patient right in front of me curing Hep C or removing polyps or whatever. So I found that I had an innate need to serve my fellow colleagues and help them be successful in their careers as well.
So how would you sort of describe your leadership style? And is there a specific experience or mentor that really helped influence how you define your leadership?
I'm definitely a servant leader. That's been modeled by me by so many, whether it was my direct boss, who now, ironically, I'm his boss, or whether it was the board of directors members that I got to work with, or the internal medicine section chiefs. I've seen it modeled before me that those who aren't afraid to get dirty and to get messy and also invest in others and put their neck out on the line for others were able to have an entire following behind them that believed believed in them, believed in their goals and their mission, and I just amplified that and modeled that. And as a result, I continue to have others following behind me. So I've had it modeled well, how to be a servant leader, how to get dirty. For instance, my boss, John Irwin, who's the head of medicine here, he is on Twitter as Heart of Texas Heart, and so he wanted me on Twitter. And I said, I don't know if I have enough time for that. But as a result, everything I tweet, he's able to retweet, and we're able to expand it. And we've got an international following where we're talking about women medicine, we're talking about liver disease, we're talking about disparities because of his amplification. And then having some of the C-level leaders like Bob Proby and Alex Aroliga, who nominated me to be part of this amazing cohort in the WEL program, allows me to connect with those throughout the nation to, again, amplify our efforts. So it's just been fabulous.
Wonderful that you've been able to spread this work together.
Yes.
So speaking about the women, particularly in leadership, I believe 2012 may have been the first year that the number of women enrolling in medical schools surpassed actually the number of men. I may have the date wrong. But what are those workplace inequities that you're seeing that really need to be addressed to help the profession move forward?
You're exactly right. We're at 51% females in medical school right now. The women that are out in the workforce, we're at 35% practicing physicians. But if you look at those that are age 45 and under, we're the majority. So we have a lot of work to be done. There is a lot of sexual harassment, specifically gender harassment and gender bias and unconscious bias, that makes it a very unlevel playing field, and people assume we have the same opportunities because we have the same education. However, literally on a day-to-day basis, I continue to face gender harassment, and those younger than me definitely do. So getting the males partnered, that even though you may not think you're part of the problem, if you're silent and allowing this to occur next to you and not speaking up on behalf of the women that are enduring this, then you're actually helping the problem be perpetuated as a normal culture of medicine. And that's extremely unfortunate. When you look at STEM, you look at engineering, you look at science, there is underlying gender harassment. But in medicine, it is much higher than other realms. So there's been this disconnect hierarchical relationship between the doctor, which was traditionally male, and the nurse that was traditionally female. And as a result, there is a lot of tension between the genders in the field of medicine. So if we're able to talk about it more, and the Me Too movement has definitely given us that opportunity to have these previously taboo conversations, and to point it out, once you're aware of your underlying bias, you can't change it, but you can become aware of it so that when you see it or when you hear it from yourself, you can pause and reframe a response. So there's specific training called bystander training to help the men come beside. And I think that's our ticket right now, is the he for she movement, is having the men that already have the amplified voice to be able to use that, just as so many of my leaders have done, to amplify our voice so that we're able to make people aware that we don't want to discount 50% of doctors that are going to retire early or leave the practice or not be as efficient or effective. We know that healthcare is stronger when we're all stronger and we're all able to perform at the top of our license and the top of our abilities. So I think partnering with the men is the key to that.
Absolutely. And tying back to your earlier point, really being able to amplify that voice and use the platform that you have as a leader to make sure that you're highlighting your entire team.
Exactly.
So I know you're working on a model for leadership training as a tool to prevent burnout among women physicians. Can you talk to me a little bit about that and how your own strategies helped inform and build that model?
Right now, my charge as part of the WEL program, we had to come up with an overarching theme over the next 18 months of what we want to accomplish. What I wanted to accomplish was to help these busy women who are leaders at their institutions to not recreate the wheel. And so what I've put together is a 23-page packet, and it goes through the roadmap of how to do a women in medicine support program. Everything from the business case to how to get the leadership support, because if you don't have either of those two, we're not going to get anywhere, as well as who should be on your committees, what timelines should you look at, sample agendas, sample budgets, sample surveys, because you've got to have data for anything to be done in the modern era. You've got to show people, show me the money, show me the ROI. So we want to do the work ahead of time so that the women can focus on actually instituting the program in their local facilities. So I'm extremely excited to say that we've got our packet put together and we're getting ready for distribution to the world. So that's a lot of fun. And then the second part of your question about how do I prevent burnout in myself, this is something I talk about at our leadership conferences. And it's a surrender to no longer being a type A plus personality, but I have to be an A minus personality, which is hard for us to do. We got here by being A pluses. But if you're going to maintain your balance, good enough has to be good enough. So I no longer take pride in my clinical documentation or in cleaning my house. So I do the minimal clinic documentation that I need to do, and then I use these things called sticky notes on Epic to make my own personal note very robust. I refuse to chart at home, and I hire someone else to clean my toilets, and I am so much happier now. So when I'm at home, I'm actually at home. I try to be present wherever I am. I'm not checking the nanny cam or, constantly texting my husband to see what the children are doing. And when I'm at home, I'm not constantly checking the EMR and seeing what my patients are up to. There is a check-in point, maybe once a day on both accounts, but otherwise I am present where I am. And that has greatly helped with my guilt and greatly helped me to not feel like I'm a failure at both work and home. Through all of this, again, as I mentioned at the very beginning, have a supportive husband and 3 kids who understand what I'm going through and being able to talk to them about the struggles, that this isn't magic, that it isn't real, mom isn't superwoman, but I do have my days where I do it better than other days, and every day is a do-over, and I get to try to do better the next day, and giving other women that protection against perfectionism, where good enough is good enough. So I continue to say that to my women that are underneath me that I'm mentoring that come to me in tears, but I didn't do this perfect. I said, absolutely. And next time it won't be perfect either, but it'll be better. And that's okay. And that's what we're striving for.
I love that idea of becoming an A- student. I had a boss who used to say very often to me that there is no such thing as an A++.
Yes.
So I think that's a lesson that definitely is hard for some of us to really internalize, but I'm glad that you're working with your team. So to wrap up, tell me a little bit about what makes you hopeful about the future of medicine, and both from the profession and just overall.
Right. Even though we do know we have issues in medicine, we do know that it can be a hostile environment for women. More women are coming, more women are participating, more women are willing to have these conversations, and more men are partnering with us. We do know that when women come into the healthcare field, all of healthcare actually improves. There's been the recent study about the female patient coming into an emergency room, and if she's cared for by a female physician or a male physician who is surrounded by more female physicians, the survival of that patient increases. We also know the studies from surgery that the surgical outcomes can be better if women are taking care, or women are the surgeons. And then in the Medicare population for inpatient hospitalizations, there's lower length of stay and less costly admission if it's a female attending. So I think we push the envelope by being there, just being present as female physicians. We make all of healthcare better and potentially safer. When you think about who cares for the patient, when it's a child coming into the hospital, it's usually the mother at the appointment. When it's a dad with a broken hip or mom having a heart attack, it's usually the daughter who's there. So we, as healthcare providers, are often the recipients of healthcare too. So the way we see healthcare can be different than some of the males that are not necessarily as involved as a general rule. Of course, we have men that do come to the appointments with their kids and with their parents, but as a general rule, it is on the women of society. So I think that I'm very hopeful because we're able to talk about these system issues of healthcare and understand both sides of the equation a little bit better. And I also believe that the Me Too movement, again, has allowed us to have these conversations that have been long overdue. So I'm excited about that. And then the other unintended consequence we found when we dove into our data of our women physicians is when you look at our male physicians, 75% were white men. And when you looked at our female physicians, it was a rainbow. So we only had 50% white, Caucasian, traditional, but then everything else was represented. So I love that we're having more women come in because it's increasing diversity in every way possible. And that just helps more of our patients to feel comfortable and more of our patients to actually follow through with their recommendations. Because if a patient's cared by somebody who looks like them or they can relate to, there is a compliance perspective that is enhanced. So I think we're all better with more diversity.
Absolutely. I couldn't agree more. What a great note to end on. Well, I want to thank you for both participating in the WEL program over the next 18 months as one of AHA's participants, but also for taking the time today to share your thoughts, and look forward to hearing the outcomes of your program.
Wonderful. And thank you so much for amplifying us. You are part of it. You are the she for she. So I greatly appreciate your partnership with us as well.
All right. Well, thank you so much.
Thanks, Lisa.